now with our special segment on vet tips and practices. Here's Vet Call with Dr. E. Good morning, Dr. Easterwood. How are you doing today?
Good, Rebecca. Thanks for having me this morning.
Yeah, well, I'm glad you're here. And, in the past we've talked about lacerations and more of an emergency situation and what to do about that. But we want to get a little bit more in depth and talk about locations of lacerations and what that can mean for the horse and for the wound itself. So, first of all, just tell us, what is the most common site for a horse to get a laceration?
Sure. Well, we're here at Easterwood Equine Hospital this morning, and there's really not a most common site for equine lacerations. I mean, they can really get them anywhere. I mean, me and Isaac had to go out last night and actually sew a horse's lip up. But this horse here actually sustained a laceration to her left hind fetlock, and Frankie's going to kind of zoom in on that and see if she can get you a good picture. Can you see that okay?
Yeah, sure can.
And so you can see this is a V-shaped laceration, but this laceration actually extended into this horse's fetlock joint, into the ankle joint. And before we repaired the laceration, we actually had joint fluid coming out of it. So we wanted to talk a little bit about that, not just about lacerations and how they heal, but kind of the significance of the location of lacerations after you get the initial bleeding and hemorrhage stopped, which is very important. But you always want to make sure that the laceration is not over a joint, and any joint could be a potential life-threatening injury if the joint is compromised from a laceration like this horse's. And so it's very important, if you've got even a small laceration, that you have a vet take a look at it to make sure that it's not in a joint. That could be in the fetlock joint here, could also be in the hock joint, the stifle, or any potential joint on the horse, anywhere that has motion in it. And so that's very important to kind of recognize that. Like I said, not just the size of the laceration or the amount of bleeding, but also the location of the joint of the laceration. Excuse me.
All right. Well, I had a friend recently whose horse got run through a barbed wire fence and got a laceration or a puncture in like a tendon capsule or something like that. And she's been having to dress and change the dressing of the wound for 3 months. And that what she's most concerned about is the infection inside there. Is that what you're talking about, where it can really affect them inside their body?
That's definitely what we're talking about, and we also worry about what you're talking about. Tendon sheets, they act the same way as joint capsules do, and those also usually surround joints. So anywhere there's potential motion, like in the knee here, say we had a laceration right over this area. Can you see that okay?
Yes.
That can be very dangerous. Also in the fetlock area, like we've got on the hind foot, the elbow or the shoulder joint can be a potential dangerous situation. If you've got a laceration, say up here on the torso, where there's not a joint, you can have a large laceration that heals fine on horses. But inside of the joint, we worry about infections inside of those joints, because those infections can create arthritis and ultimate chronic lameness down the road. And so it's very important to get that checked out early on so that we can stop that infection and get it treated before it causes any joint damage, which is what we were able to do on this pony here. We were able to get to this pony really quickly and flush all the bad stuff out of this joint capsule, and then place antibiotics directly back into the joint, and then repair the actual laceration so that it's not open to reinfection.
Okay. And how important is it for the horse owner, to keep that dressing changed and cleaned? Because it may appear on the outside like it's healing up, but on the inside, it may not be, right?
That's correct. It's very important to keep a clean, sterile dressing on this bandage like we've had on this horse. We've got it open today just so we can show you guys at home, but it's very important to keep the horse on antibiotics for extended period of time, and also keep clean, sterile bandages over the wound to keep it from getting recontaminated.
Okay, then also I wanted to ask you about wounds that are in areas that gap and may pull stitches out, because, as you know, my horse Luke had a big rip on his shoulder, and, he went to the hospital there, and it couldn't stay closed. So, what we end up doing is just dressing it every day and cleaning it every day and debriding it, or debriding it, however you say that. So, what do you do about wounds that are like in gap areas?
Yeah, that's a very good point. We've actually got one here. We're always worried about tension and motion for laceration repairs. Those are your two enemies because those can pull your stitches through. It's not always a big deal. Again, if you've got a laceration that's not inside of a joint, you know what we call second intention. You have to keep them clean. But horses do a really good job. If you can keep wounds clean, they will heal on their own, even if the stitches pull through. But as you can see here, this laceration here is directly over this joint. So each time she bends her ankle, it's pulling on those sutures there, and that's a problem. And it's also the skin is pretty tight across this deal here, and so those are two enemies, and you always have to worry about that. It's not always feasible to be able to prevent that, but those are definitely concerns.
Okay. And then just real quickly, just tell what folks need to do to clean a wound.
Yeah, what I recommend is just a mild soap and water, whether it be dial soap, or ivory soap, or a betadine scrub, and then any type of topical, wound treatments, antiseptics, things like that. I tend to just like I said, mild soap and water, because a lot of your salves and creams tend to trap a lot of dirt and bacteria to the wound.
Right.
And to me, may cause you more problems than good, rather than just having a nice clean wound. You can see this wound here is nice and healthy. The skin is starting to reattach, and we're just kind of keeping it clean with some mild soap and water. We're not putting a whole lot of topical stuff on there. We're just cleaning it really good every day and keeping a nice sterile dressing on there to prevent it from getting dirty.
Okay, and then one final question. I know you really can't horse-proof a barn or a farm, but do you have any suggestions for horse owners to kind of keep down injuries from lacerations?
Yeah, I mean, just take a look around your barn. Try to take a look at anything that could potentially cut your horse, whether it be nails sticking out of walls or barbed wire, pieces of broken barbed wire. Check all of your buckets. Eyelid lacerations are really common from buckets. The little hooks that hold your water buckets on the side, it's a good idea to tape those up, because we feel like their eyelids get caught in those, and sometimes you can have upper eyelid lacerations from those as well.
That's a great idea. Well, thanks for sharing your knowledge with us today. We appreciate it, Dr. E.
Okay, Rebecca, thank you.
All right. And listeners, if you want to learn more about Dr. E, you can go to easterwoodequine.com or call 205-663-4000. This is Becca Salomon, the voice of Southern Horse Talk, saying thanks for listening to Vet Call with Dr. E, bringing you tips and practices from the equine veterinary world. Submit your vet questions to Becca at southernhorsetalk.com, and stay tuned to hear your questions answered online on Southern Horse Talk's YouTube channel. Thanks so much. Bye-bye.
You're welcome.